Baghel, welcome, to the All India level Chai Masti web session. We are organizing these sessions from last 2 years online, and now it's physical also we have started. And we are very happy that today you are here. So before we start, let me introduce our speaker. Dr. Paritosh Baghel has completed MBBS from Grand Medical College and Sir JJ Group of Hospitals in Mumbai. In 2003, he is MD Medicine from GS Medical College in KM Hospital, Mumbai in 2008. And he has expertise in various fields like blood pressure, diabetology, general checkup, hypertension, infectious disease, etc., etc., etc. So, Mr. Dr. Baghel, once again, we welcome you. And we are all of us actually, all our members and myself also, we are very eager to know that how we can take care of our health during the monsoon season. Okay, so over to you, Dr. Bagelji, and I'm going to mute everyone so that there'll be less disturbance. And I'll also request that let him complete his talk, and then at the end of the talk, we will have a question and answer. So please don't try to unmute yourself in between and disturb the entire session. Okay, thank you so much. Over to you,
Thank,
sir.
Thank you, Dr. Joshi. Thank you so much. It's a good initiative where we are going to talk about certain things where prevention, because I believe that prevention is always better than cure, and it is just not better in terms of health wise, it is also monetary wise beneficial in the sense that it is less costly because prevention is less costly as compared to the treatment. So today I'm going to talk on the topic of monsoon related illnesses and what are the ways by which we can prevent, what are the various types of monsoon related illnesses. And thank you for the kind introduction. I am associated with Fortis Raheja Hospital as of now. I have done my UG from JJ Hospital, then I did my PG from KM, and now I'm attached with Raheja as a consultant physician. I take care of internal medicine, and also I am an LLB. I have done my law as well, so I do take care of medical legal cases as well. So, but my first interest is medicine only. So let us start with this topic. I would like to share my presentation with you all. Is the presentation visible?
Yes.
Yeah. So as you rightly said while I was listening, Dr. Joshi, that monsoon kitna bhi ho, you gile ho hi jate ho. That's the fact of life, and that is a fact in Mumbai. Monsoons are the most ferocious season I would say among all the seasons, and you are bound to get wet. And when you are bound to get wet, you are also bound to get some or the other infection. So monsoon illnesses, prevention and management. Yes, this is what the site is. Generally, rainy season brings a lot of fun, greenery, cool climate, and lots of memories associated with this season. It also reminds us, especially in Mumbai, the cutting chai, along with some sort of a snack like bhajia or something, which is just irresistible during this season. I'm sure most of the Mumbaikars will agree with me, and that's all the fun part. But at the same time, when we look at it, we see that rainy season also brings with it a host of diseases, and which can be mild to life-threatening ones. And as you can see, the diseases which can occur during this season can be classified into various 4 types of diseases according to the way they are spread from person to person. So the most commonly is the common cold, which we generally call as a flu, which could be due to influenza virus or any other viral infection, which is a viral flu. And it is an airborne disease, means it is spread through the air from person to person. Waterborne diseases, which are common because of the flooding, because of so many water-related issues, and the common diseases which we see during monsoons are typhoid, cholera, jaundice, diarrhea, and leptospirosis. There are certain diseases which are spread through bite of mosquitoes or by houseflies or by some organism apart from the air. That is like, these are called as vector-borne diseases. And the most common organisms or the most common infections which we see during monsoons are malaria, dengue, and chikungunya. And also the class of infections which we see during monsoons is the skin diseases, and among them the most common are the fungal infections which we see because of the high moisture in the weather. Now let us tackle one by one. What are these airborne diseases? They are spread by droplet transmission. As you can see, when a person coughs or sneezes, he throws a lot of droplets. And if a person is infected while he is coughing or sneezing in open without covering his mouth or his nose, and if you come in contact with these droplets, you will catch the infection which the person is spreading. Also, when we cough, these droplets deposit on various objects like on the desk, or if the person is not covering his mouth with a cloth or something, he covers it with his hand. The droplets are transferred to your hand, and that hand touches the knobs of the doors and all other places, and you incidentally touch that place, then you are bound to get this kind of an infection. And the common diseases which are transmitted by this mode is common cold, influenza, various other respiratory diseases. So viral disease, very common, the most common infection during monsoon. Once you get wet, you're bound to get it in, provided your immunity is strong, you may able to hold it. But otherwise, most of us do get, because any amount of immunity will not protect against viral infections because they change their shape very frequently. What are the various symptoms? Basically, constant sneezing, sore throat, fever are the common symptoms of the disease, but you may get any symptom like headache, fever, muscle weakness, extreme tiredness, joint pain, coughing, runny or stuffy nose, body ache, sore throat. All these things can point towards a respiratory infection, mostly in this season due to viruses. How to avoid it? The prevention, very, very important. The easiest way is to first get yourself drenched in the rain, but that is in Mumbai, it is very difficult. Make sure that you dry yourself completely if you have got wet. If you are using air conditioners, make sure that you don't have a very chilly temperature. Avoid ice creams. If you catch common cold, then the best homemade remedy is a glass of hot turmeric milk, which we, our parents used to tell us when we used to be children, when we used to be child, we used to do get it, although we never liked it, but still we had to, and it worked very well. Gargles with warm water and salt can definitely give relief to your sore throat. And if things don't improve by doing all these activities, and in the next 24 to 48 hours, if things are not improving, then it is always better to see a doctor so that he can give appropriate medications and treat it and find out what the cause is. So the preventing the flu, avoid close contact, avoid close contact with people who are sick. And when you are sick, it is a social responsibility which is upon you to keep distance from others so that you can protect them from getting sick too. Stay home when you are sick. Cover your mouth and nose in case when you are sneezing or coughing. Clean your hands, wash your hands, will help protect you from many of the germs, not just viruses. Avoid touching your nose or eyes. That is a common source of mode of infection. And practice other good habits like getting plenty of sleep, be physically active, manage your stress, drink plenty of fluids, and have nutritious good amount of food. Next will be the class of waterborne diseases. Now, waterborne diseases are spread through the fecal-oral route, means the person gets the infection after he consumes or drinks contaminated food or contaminated water, which contains the organism, which contains the germs. As you can see, if a person who's infected transmits he does open defecation, the germs are transmitted either to the fingers, or the flies may carry those germs, or from the fields, from not properly cooked food, or from water. There is a problem with water supply. Then these things enter into your food, and when you consume this contaminated water or food, that is the way you get this kind of an infection. Most common infections which are transmitted by this way are diarrheal diseases like typhoid, cholera. Diarrhea in the sense multiple loose motions, watery, and that can sometimes be very, very dangerous. other infection like hepatitis that we call in layman term as jaundice, and other infection which can happen because of fecal route is leptospirosis, which was the major cause of death in. There was an epidemic in Mumbai during the floods in 2005. So typhoid, when we look at typhoid, it's a waterborne disease, very common during monsoon. Spread the infection very rapidly to others if he does not follow the sanitary methods. It is caused by a bacteria called Salmonella, which is transmitted through consuming contaminated water and food. And the worst part of the infection is, even if you are cured, if you are not cured completely, if you have taken some medications and which has not cured you completely, it may remain in the gallbladder of the patient, and the person may be keep on maybe spreading, will keep on spreading the bacteria to others, although he may not have any symptoms, but he may become a carrier. And there have been documented evidence about carriers which has spread this kind of infection to others. The most common symptom of this disease is you getting prolonged fever with pain in abdomen, in the stomach, headache, and diarrhea. Patient should be isolated from the rest of the family so that they don't get infected. Vaccination is available in childhood as well as in adulthood. And patients should get high intake of fluid to prevent dehydration, which is associated with this kind of infection. As I had told you, there is a documented evidence of people who may spread the infection, although they may not have any severe infection, because their immunity being better, they have recovered from the infection, but they are still shedding the virus. There was a lady named Mary who had infected 47 people and almost out of which 3 killed. And she constantly changed her employment because wherever she used to work as a cook, the household people used to get sick, and they used to be she was forced to leave the employment. And once she came to know that she is the cause of infection, she used to assume false names and began cooking again and again for many people. So once it was found out that she is the source, and she was labeled as almost by the name of Typhoid Mary. Another infection which is dangerous, which is waterborne, is cholera. It is a deadly disease. Large-scale epidemics and pandemics have occurred over so many years, and India is the originator of most of these epidemics. And it indicates that there are poor sanitation facilities because of which cholera is spread. It is a bacteria which causes cholera, and it's usually found in food or water which is contaminated because of this. The symptoms are severe diarrhea with watery stools, and the watery stools are like kanji, that is rice water like, a most common symptom of cholera. There could be associated vomiting, and there could be severe water loss and muscle cramps associated with this infection. It can cause severe dehydration and rapid death. So early recognition and treatment is must. Vaccination is available but not so very commonly used. The most important key to prevent such kind of an infection, especially during monsoon season, and when we think that the water is contaminated, is to prevent the infection by boiling the water. Boil the water, filter it, and then only drink it. So sanitation is very important. Another infection which is very common is jaundice, which it can be because of hepatitis. It is generally caused by a virus called hepatitis A or hepatitis E virus, and this is what is spread through contaminated food and water. And flies are the major cause of spread of this infection. It can also be spread when you come in contact with a patient directly. The symptoms of this disease are similar to flu. The patient may develop similar symptoms like fever with headache, joint pain, and vomiting. And after some days, the patient may find that his eyes are become yellow, or the urine has become very yellow. That is a time when you come to know that you have got jaundice, and probably you are suffering from hepatitis. If that happens, one should take complete bed rest. The patient should be given high calorie diet, but fat and oily food should be avoided. And the most important prevention of this disease is by doing vaccination against this infection. The vaccine is available in almost all government and private hospitals. Another waterborne diseases is gastroenteritis, which we many a times call as food poisoning or diarrhea. Generally, it is because of an infection of the stomach or the intestines where they become irritated and inflamed, and that leads to multiple times of loose motions. It can be viral, as I told you, or it can be a bacterial infection. Usually, it is accompanied by pain in stomach, loose motions, vomiting, and fever. And prolonged diarrhea, if it is not treated or if there is no rehydration which is done, then it can be fatal. Another waterborne disease, as you can see in this picture, is leptospirosis. It is generally seen during the monsoon season only because of the flooding. The rats come out, they come out, they urinate water, and they carry this organism. And when you walk through this contaminated water, you can get infection from the skin. There are many cuts on the legs which we have, which are microscopic, and through that the organism, the bacteria leptospira can enter and we will get infected. Also, it can be this infection can be had by swallowing contaminated water and food. What are the symptoms again of leptospirosis? Fever, headache, joint pains, and there is a definite history of the person wading or moving through dirty water. If that is a case, and there is yellowish discoloration of the eyes, if there is body pain, headache, you have walked through dirty water in this rainy season, and you have started getting these symptoms, you should report yourself to the doctor to rule out that there is leptospirosis so that you can take treatment. How to prevent this infection? Avoid wading in flooded waters, especially if you have an open wound on the leg. And if this is unavoidable, wash your feet and legs with soap and water immediately after traveling. How to prevent these waterborne diseases? First, toilet barrier. So open defecation should be avoided as much as possible. There could be a safe water barrier, where in the sense a good, safe water, potable water, boiled, filtered water should be consumed. Second is hand and hygiene washing barriers, where proper hand washing is to be followed. A proper hygienic measure should be followed. And this is the way where you can block or you can prevent these infections to occur. So what are the general guidelines to prevent? Do not defecate in open. That's the toilet barrier. Have safe drinking water. Maintain a personal hygiene by regular hand washing. Food hygiene. Eat well-cooked foods. Avoid raw food items like salads. I see many a times people eating raw salads which is cut outside and sold on the streets where houseflies sit on it and it is not even covered. So I ask them not to eat those salads or raw food items. Cover the food to prevent flies sitting on the food. And isolation of persons who are affected with the disease. Vaccination if necessary to prevent the disease, and early treatment. What about vector-borne diseases? Well, it is spread by a vector where it can be an animal, insect, or an object. And the most common examples of vector-borne diseases are malaria, dengue, and chikungunya. Now, what are these vectors? These are small organisms that can carry serious diseases. And the common vectors which we have is mosquitoes, sandflies, ticks, houseflies. They spread the infection from person to person by carrying those germs within them or on their wings or on their legs. And with just one bite, these vectors can transmit serious diseases like malaria, dengue, yellow fever, jaundice, encephalitis. When you talk about malaria, it is one of the most common diseases that catch you in the rainy season. We see many patients with malaria and dengue during this season because during this season, it is a perfect breeding season for these organisms. This disease is spread by a mosquito called Anopheles. It's a female mosquito. Since there is a problem of waterlogging during the rainy season, mosquitoes get conducive conditions to breed. And this is one of the most dangerous diseases in India with the highest number of deaths credited to it. What are the symptoms of malarial fever? Their fever occurs at regular intervals with shivering, chills, muscle pain, body pain, weakness, and it may be malaria. So always do a blood test, consult your doctor so that an early diagnosis and treatment can be made. How to prevent malaria? The ABCD approach means to remain aware of the symptoms, recognizing malaria. As I told you, fever, sweats, chills, history of mosquito bite, mosquitoes in and around you, possibility of malaria is there. How to prevent? By bite prevention, by controlling the mosquitoes, by remaining inside, using the nets, mosquito bite prevention outside, where you limit outdoor activities, especially during evening time when the chance of mosquito bite is more, using insect repellent, wearing long sleeves, taking chemoprophylaxis, more so for people who are traveling to India. And next is diagnosis, where you diagnose by doing a blood test. The second vector-borne disease is dengue. It is again caused by a mosquito bite, but the mosquito is different. It is by Aedes aegypti. It is also called a tiger mosquito. As you can see here, the photograph, it has got stripes on its body and looks like a tiger. So it bites during the day as compared to the Anopheles mosquito. It bites especially during the dawn and dusks, and it lays eggs in clean, stagnant water. That is why you'll find that these areas where there is stagnation of water has to be discarded. And BMC, especially the Bombay Municipal Corporation, has started a program where they keep on checking at societies where there is stagnation of water, and they create awareness among people to discard this water. What are the symptoms of dengue fever? Again, there could be headache. Severe headache, body ache is classical of dengue fever. There could be fever, muscle pain, joint pain, vomiting, rash. All these can be the symptoms. And if the patient is not improving, or patient has ignored his symptoms, he may land up into a severe dengue where death is imminent. Another infection which is commonly spread by mosquito is chikungunya. Same mosquito which spreads dengue. It is a self-limiting disease. It causes body pain and fever. There is no specific treatment for dengue and chikungunya. The only treatment is to take symptomatic treatment, hydrate yourself, drink good amount of water. So as I would say, the most important aspect is prevention, preventing the mosquito bites. So what are the general guidelines to prevent from vector-borne diseases? Take simple measures to protect yourself and your family. Get vaccinated against those infections which can be prevented by vaccination. Install window screens. Wear light-colored, long-sleeved shirts and trousers if you are going out. Use insect repellent. Prevent the breeding of the vectors by discarding or getting rid of stagnant water, and do an early diagnosis and treatment so that you can remain healthy. What are the skin infections? This is the last variety of infections which you see in monsoons. And fungal infections are very common. Generally, skin is seen in skin folds like armpits, groins, and webs of digits, scalp, and hairy areas. Nail infections are also commonly seen in people who have prolonged exposure to water, daily water exposure. The nails may appear like this, and that indicates that it is probably a fungal infection. So wear cotton clothes and loose clothes, keep the body dry, use talcum powder which are antifungal, use them in the areas where you may get fungal infection like the groins, underarms, and visit a skin specialist if the symptoms are not resolving. Then you should always visit a doctor so that you can completely cure it. So as I said, monsoons, be prepared not just for the fun as well, but also for the diseases. Maintain a personal hygiene, cover your cough and sneeze. If ill, avoid going at public places to prevent the spread of disease. Food and water hygiene should be maintained in monsoon. Wash hands adequately. Drink boiled and filtered water. Wash food items thoroughly. Cook the food properly. Avoid raw fruits or vegetables, especially from the street. If it is unavoidable, you are really hungry, you want to eat something, then eat fruits which can be peeled so that the contamination can be minimized. Avoid eating out. Follow good sanitation practices like wash hands after going to the toilet. Maintain cleanliness in and around your surroundings so that the breeding of mosquitoes or other vectors can be prevented. Control the vector-borne diseases by using nets, mosquito repellents, prevent the breeding of mosquitoes, and Last but not the least, maintain good immunity and a healthy lifestyle by eating nutritious food, exercising regularly. You don't have to exercise too hard. Daily walking for 30 minutes is good enough to maintain a good immunity. Have a good water intake throughout the day. Have a nice sleep. That is very important to maintain a good immunity. Thank you so much, and I wish you happy monsoons.
Thank you, sir.
Thank you.
If there's any questions, I am ready to take it.
Thank you so much.
डॉक्टर साहब हर फ्रूट जो है उसको
ना।
पील करके खाना चाहिए?
नहीं नहीं, हर फ्रूट को नहीं, जिनको हमको पील करना है, जैसे बनाना है उसको पील करना है। बाकी जो फ्रूट्स को पील करने की जरूरत नहीं है उनको अच्छे से धो के खाना है।
ओके।
आप बोले सेब को भी हम छील के खाएं, ऐसा नहीं है। अच्छे से धो लिया तो दैट इज गुड इनफ। बट ओनली थिंग इज कि रॉ फूड आइटम जो हम बाहर, जहाँ पे मक्खियां बैठ रही हैं, जहाँ पे कंटेमिनेशन के चांसेस हैं, वो चीजें अवॉइड करनी है। आप घर पे फ्रूट ला के उसको अच्छे से धो के खाइए तो उसमें कोई प्रॉब्लम नहीं।
वो बोलते हैं कि पोटेशियम परमैंगनेट से धोना चाहिए।
पार्डन?
पोटेशियम परमैंगनेट से उसको करके फिर धोना चाहिए फ्रूट को।
ऐसा कोई गाइडलाइंस नहीं है। नॉर्मल रनिंग सोप वाटर, नॉर्मल वाटर से आप धो सकते हैं। अगर बहुत ही विजिबली सॉइल्ड है तो आप अच्छे से आप उसको, अदरवाइज नॉर्मल रनिंग वाटर, प्लेन वाटर से आप कोई भी आप फ्रूट धोइए, कोई दिक्कत नहीं।
थैंक यू सर। सॉल्टी वाटर
में इन्फेक्शन हो जाता है मॉनसून के टाइम में।
मैम अगर वन बाय वन अगर सब पूछेंगे तो आई वुड बी एबल टू आंसर।
बहुत जॉइंट पेन है अगर मेरे को हो तो उसके लिए क्या करें?
जॉइंट पेन, देखिए पहले तो ये है कि वो जॉइंट पेन क्यों है, उसका आपको रीजन ढूंढना पड़ेगा। वेदर इट इज बिकॉज ऑफ नॉर्मल वेयर एंड टेयर, एज रिलेटेड है, या किसी इंजरी की वजह से है, कहीं मार लग गई है उसकी वजह से है।
दोनों वजह हैं।
हाँ, तो आपको ऑर्थोपेडिक को दिखाना पड़ेगा कि भाई क्या है और उसको कैसे केयर किया जाए।
Doctor, washing the vegetables with the salt water is good, no? Washing the salt water.
Salt water?
Yeah, vegetables and the spinach and those things.
Yes, that is
coriander and those.
तो नमक के पानी में, हाँ, हरी सब्जियों को आप नमक के पानी में डेफिनेटली भिगो के आप धो के उसे ठीक रख सकते हैं।
थैंक यू
डॉक्टर। आईज में मॉनसून टाइम में अक्सर इन्फेक्शन आ जाता है।
यस,
उसके लिए बताइए कुछ प्रिकॉशंस।
सिंपल प्रिकॉशंस है। इन्फेक्शन होने का एक ही रीजन है, कहीं ना कहीं से बैक्टीरिया।
म्यूट कीजिए सब लोग,
म्यूट कीजिए डॉक्टर साहब,
सबको म्यूट कर दीजिए। एंड देन आंसर।
बैक्टीरिया या वायरल कोई भी इन्फेक्शन कहीं ना कहीं से जब इन्फेक्शन हमारे बॉडी में प्रवेश करता है तभी इन्फेक्शन होता है। तो आईज में यदि इन्फेक्शन है तो डेफिनेटली कहीं ना कहीं से आपने, या तो आपके हाथों के थ्रू आंख आपने मली है या आंख में आपने उंगली लगाई है, जो कंटेमिनेटेड हाथ हैं, फिंगर्स हैं। तो बेसिकली हैंड वॉशिंग टेक्निक है जो सबसे इम्पोर्टेंट है। हाथ धोना रेगुलरली, किसी भी तरीके से जर्म्स हमारे आईज में न जाएं, वो सारे टेक्निक से आप आई इन्फेक्शन या कोई भी इन्फेक्शन फॉर दैट मैटर प्रिवेंट कर सकते हैं।
डॉक्टर साहब, ये आँख के अंदर भी जैसे हम वो करते हैं, आँख के अंदर पानी चला जाए तो ठीक है कि नहीं?
कई बार तक कोई दिक्कत नहीं है पानी जाने में। इनफैक्ट कई बार कंटेमिनेटेड, जैसे छींटा उड़ गया किसी चीज का, कई बार हम बाहर चल रहे हैं और कोई छपाक से छींटा उड़ गया गंदे पानी का, तो भी उससे डायरेक्टली ऐसे बहुत जल्दी कोई इन्फेक्शन होता नहीं है। बट प्रोवाइडेड यदि आपके आंख में कोई ऐसा पानी गया है गंदा, तो आपने तुरंत हो सके तो आके मुंह धोएं और आंखों में पानी डाल के आंख को धो लें। पानी जाने से कोई प्रॉब्लम नहीं है, साफ पानी से कोई प्रॉब्लम नहीं है। Mr. Kashi Vishwanathan ji, you have raised a hand.
Yes, doctor, thanks for noticing me. You have explained very well about various types how we can prevent. Most
Fruits and vegetables, what
vaccination.
with potassium, it is better, isn't it, doctor?
Particularly,
Potassium, thora lele dal de.
yes,
What
yes.
vegetables and fruits.
Yeah, but that is not good for everyone. You cannot blanket tell this कि potassium सभी के लिए अच्छा है. किसी किसी को creatinine का issue होता है, किसी को kidney का problem है, तो उसके लिए potassium ठीक नहीं होता है.
Okay, is it? हाँ.
my
Not
question
sure.
Yes,
is about,
Mr. Vishwanathan ji, I want to hear you.
yeah, somebody else was talking, so I kept quiet. About the fungal infection. Fungal infection, there is no vaccination or anything, isn't it? So how does one prevent fungal infection?
So as I have told you in my talk, that fungal infections are common at those areas where there is moisture, where there is friction. So most of the times fungal infection हमको groins में होता है, underarms में होता है, webs of fingers, उंगलियों के बीच में. Those are the areas, and especially जहाँ wetness है, जैसे अगर जिनका पाँव पानी में काफी काम है, हमेशा पाँव पानी में रहता है या हाथ पानी में रहता है, तो fingers के बीच में infection होता है, fungal infection. So the most important is to avoid the moisture, यानी कि जो dampness है उसको दूर करना है. जैसे आप घर में भी देखेंगे, घर की दीवारों पे जहाँ dampness होती है वहाँ fungal infection आ जाता है. तो dampness should be avoided. तो अच्छे से dry, keep your body dry. That is the most important. Second thing to prevent is use talcum powder to keep the areas dry where there. Use talcum powder like antifungal talcum powders like Zocon or any other antifungal powders you can use to apply in those areas which are prone to get viral fungal infections. Second, have a good nutritious food, consume good amount of water. These are some of the things. Avoid contact to a person who's got fungal infection. Fungal infection can spread from person to person also.
Sir, in between the fingers, if the fungal infection is there, to avoid the wetness, if you apply Vaseline, it works well.
Yes, you can do that.
Yeah, because fingers are very close in my left hand, so I have to put all the time. That's what the doctor said.
Yes.
Apply Vaseline to avoid the wetness.
Vaseline, or you can apply oil also. There is no problem in applying oil.
Instead of talcum powder, that is better, I guess.
Yeah, but sometimes say oily causes lot of stickiness, especially when you apply oil on the groins or anywhere area. It is better that we apply talcum powder after taking a bath so it remains dry. But oil can be applied
between the fingers.
Yes, absolutely.
पानी में हाथ पानी में जिंदा वाले डाले नाव में उसी वजह जा रखे जाना तो
बिना
फंगस
न रखे जाना तन में पाछा जमस्ते.
Namaste, sir.
Namaskar.
Thank you, sir.
I hope I have made it very simple and clear for everyone.
Yes, yes.
Very clear, doctor. Very nice lecture.
सब कुछ जानते हैं, but we become careless, easy going.
Yeah.
Then we face the problem.
Very simple methods. As I told you, it is prevention. Prevention is the key.
It's always better here.
Yeah, it's always better. It is always better. And it doesn't take much of efforts to prevent something. But treatment requires a lot of efforts, lot of things. Yes. Prevention is easier. Yes, Mr. Rajapan.
It is easy to say, avoid contacts. You know, the type of life what we have got, we cannot avoid going out. Impossible. That's why I'm not saying, Mr. Rajapan, that one should not go out. No. I am not telling you that you have told me. Best thing is, whenever you go out and come back, wash your hands, wash your teeth, wash your feet. Always keep it dry. Okay. Another thing, important thing is, whenever you go out and for a feast or for a friend's house or anything, try to avoid sipping the drinks or anything, because that is the easiest way of contamination. Take the water slightly above the mouth and take it. That may be rather, nowadays it became very common sipping the food. Very, very important what I have experienced in my life is, avoid taking very cold things and very hot things. Very
Yes.
cold things and very hot things, they don't take it. Try to take which is palatable, which is comfortable for your mouth and the teeth. That's all.
Absolutely right. Absolutely right, Mr.
Thank
Rajappan.
you. Thank you.
So can we close the session now, or are there any other
Thank you, doctor.
doubts?
You have made it very clear.
Yes.
Self-explanatory.
Thank you. Thank you so much. If there's anything, do reach out to me. There's no problem at all.
Thank you, doctor.
Thank
Thank
you.
you.
Normally,
Thank you.
doctors
Thank you,
made it
doctor.
secret for the disease source and other things. Unless you are very frank and
Thank you,
easily,
doctor.
then that
Yes.
is the only thing I have found out. You are very clear and very simple,
Okay.
so that
Thank you,
then
doctor.
don't be afraid.
Wish me
How to live with that.
form.
Yes.
I'm
Yes.
going
Yes.
today tonight only. I will.
Thank you very much, doctor. Very well presented.
I need.
Thank you, Dr. Joshi.
Very good. Thank you.
Thank you, Dr. Joshi. Thank you. Thank you, everyone. It was a pleasure interacting with everyone. Thank you so much.
Happy day. Happy